I'm Kate from Ripple Podiatry and I'm doing a mini series on bunions. Today our video is on how can we help you with your bunion. So the main thing to consider with the bunions is the progression. So we've already talked about what causes it and what it is, but if you can start before you even form one, you can prevent having one. Now, one of the things that we need to consider is, as we talked about, the progression creates a lot of other issues such as arthritis, the bursa, the subluxation, and the compensations as the body goes. So these are the things we need to consider. When we're looking at what we can do to help, we're looking at how much mobility we have in the foot, and therefore how much we can revert back to how your foot's designed to work and allow the body to actually engage the foot, roll through the foot, and correct itself up the chain. If you're in the early stages, we can look at seeing what is causing the bunion, if it is something in the way you walk, and then starting to change that with gait training, sometimes footwear and orthotics. If you're starting to get pain, how we can allow the foot and the toe to work better so that the body's not stressed and irritated, and make sure that if there is some impingements that we can undo those. Now, as it's getting into its later stages, the only way you can really align it is with surgery. It's usually very invasive because they either have to fuse it, pin it, or reshape the toe itself. Now, although, like I said, that's the only way to realign it, there's a lot you can do to help it either way. Now, if we think of what causes a bunion, a lot of it is how we're walking, the pressure, the tension within all the muscles. So, to help it, we reverse that. We might look at releasing a lot of that tension, redirecting how much work this big toe is doing. The less range it has, or the further the progression is, the less we can actually rely on the big toe, so we can get the other toes to do a little bit of its work. We can block up the big toe so that we can encourage the hip to do more, and therefore you don't actually need to do all that propulsion through this big toe. We can get the hip to take a lot of that. Big, strong muscles, it's designed to adapt. So when it comes to treatment, we're trying to get the body to function better. So we can do this with gait training, we can do it with muscle release and engagement, strength training. But if you're wanting to do it subconsciously, you can do this as well. The problem with bunions is getting them to fit into shoes, because they widen your foot because of this little angle. So looking at orthopedic shoes or adjusting shoes to be more functional, or looking at an orthotic to actually retrain how your foot is and redirect how much pressure that joint is going through, how much the toe is being pushed across to begin with, and therefore you can start using all your toes again and prevent the progression, reduce your pain, and actually start to feel like you can use your foot again. So those are some of the solutions that we have for you. There are a few other tricks in the toolbox, but I'm Kate from Ripple Podiatry, and I'll talk to you again.